Hi friends, I'm Dr. Harish. Living with lung disease like emphysema, COPD or lung fibrosis can be a struggle. However, one can lead a quality life provided one follows simple daily routine or proper personal care. If one requires oxygen, there are portable or stationary oxygen systems which minimizes the inconvenience caused by oxygen therapy. In this video, we are going to watch how using the simple device, pulse oximeter, we can record oxygen saturation to adjust the oxygen settings and inform the doctor about the disease condition. Along with this oximeter can be used as a biofeedback training device along with pursed lip breathing to increase the oxygen levels. Pursed lip breathing is a simple technique to improve oxygen levels. One has to inhale the air as if he is smelling the rose through both of his nostrils, and he has to exhale the air as if he is blowing the candle. I repeat. So, using the pulse oximeter, measure the oxygen saturation levels. Then repeat this pursed lip breathing to increase your oxygen saturation levels. Ms. Dhanushree will demonstrate how to use this simple, portable, handheld pulse oximeter.
Hi friends, I'm Dhanushree H. This is pulse oximeter. This device is used to measure the proportion of oxygen saturation in hemoglobin and the heart rate or pulse rate per minute. This device runs with the help of 2A batteries. Now let's insert 2A batteries. First remove the cap and now insert the batteries. Put the cap back. This is the display screen. This is the power on button. If you press here, the mouth opens. This is the LED which emits the infrared rays and the red rays, and this is the sensor. Now insert the finger and press the power on button. Make sure your finger is not moving. The SpO2 percentage is 97 and the heartbeat rate is 101. This is the wave representation of pulse, and this bar which keeps fluctuating is the volume of pulse. Now press the button and the direction changes as per your convenience. And it's back to its original position. And now it's back to its original position. Once you remove your finger, it goes to the off mode.
This device works by emitting two kinds of rays. One is infrared rays, the other one is red rays. Infrared rays helps us to detect the proportion of oxygenated blood, and red rays helps us to detect the proportion of deoxygenated blood. When you place the finger, LCD here in the device will emit the rays and it passes through the finger, and the amount of absorption of red rays and infrared rays will be computed within this device. After the computation, this gives us a reading at the LCD screen in the form of SpO2, which indicates the saturation of oxygenated blood. I hope you like this video. Please do share, comment, subscribe.